Hey guys, former Health Secretary and current Conservative Shadow Secretary Victoria Atkins has made quite the spectacle of herself on the Trevor Phillips show. She tried to downplay the Labour's criticisms of the NHS and deflect the blame for its current state, specifically attacking Wes Streeting for saying the health service is broken due to the previous government's failures. Atkins argued that the issues plaguing the NHS were beyond the Tory government's control, and even misled viewers about the supposed pay rise for doctors. Here's what she said.
Victoria Atkins, good morning. Shadow Health Secretary now. I need to make sure that I don't make the mistake myself. Let's start with this. I'll come to the leadership in a question in a moment, but Prime Minister says that your government broke the NHS. Is he right?
No, he's not. And I think what we need to have now is a sensible conversation about the future of the NHS. As Secretary of State, I would come onto your programme, Trevor, and be very open about how, of course, the NHS is facing long-term pressures and struggling with many of them, as other healthcare systems are around the world. So we know the pressures that the fact we're all living longer is placing on the NHS. We know the fact that we're living with more multiple long-term conditions that require care and medicines. That's placing a pressure on the NHS. There are also pressures such as, for example, the impact of social media and how that is shaping young people's minds, something that we are all very concerned about. And I was clear as Secretary of State that to build an NHS for the next 75 years, we have to marry reform with investment. And I tried to do that through the productivity plan, which I understand, the tech plan, bringing tech to the front line of NHS services, but which I hear that Labour is cancelling. And what worries me is what we've seen so far from the Health Secretary. The only thing he's done is to give junior doctors a pay rise with no productivity reform.
Well, let me stop you there. I can hear viewers yelling, Streeting's come on and he's blamed you lot. You've come on and now you're blaming demographics and the past. And you had 14 years to deal with some of these problems. You left the legacy of 100,000 infants waiting more than 6 hours in A&E, 60% rise in waiting time for infants over the past 15 years, 800,000 young people on NHS waiting lists. As I said to Wes Streeting, his decisions are on him, and your record is on you.
I completely agree with that. And Trevor, by the way, I wasn't blaming demographics. I'm explaining the pressures that our NHS is facing.
But you had 14 years to anticipate and to address it, and you didn't.
If I may just deal, first of all, with infant A&Es. We know infant waiting times in A&E.
Atkins tries to shift the conversation towards the long-term pressures on the NHS, which is the people living longer and having more complex health conditions. No mention of her party's decision to underfund the NHS or funnel resources to the private sector, though. Instead, she seemed to be saying it's not our fault, it's just that people are living longer. But hang on, this government has been in power for 14 years. These problems didn't just pop up overnight. Atkins also tried to deflect by talking about social media's impact on young people's mental health. But again, this completely avoided the core issue, how the NHS has been run into the ground under her party's leadership. Then she mentioned her plans to marry reform with investment, specifically talking about the tech innovation in the NHS. Sure, technology has a role, but as many healthcare professionals have pointed out, technology alone is not the answer. Zoom calls and apps aren't suitable for every patient, and certainly not for the complex, in-person care that many people need. Atkins also claimed that the only thing Wes Streeting has done is give junior doctors a pay rise, which, to be clear, is not a pay rise. It's a partial restoration of wages that doctors should have been receiving for years. Under Conservatives, medical staff have been underpaid and overworked, and the government's attempt to make up for it doesn't go far enough to retain staff or recruit new workers. Atkins conveniently ignored the fact that 100,000 patients are waiting for treatment. Infant A&E waiting times have skyrocketed, and 800,000 young people are on NHS waiting lists. She brushed it off by talking about the RSV vaccinations, completely missing the point about broader NHS failures. This is the core issue. The NHS is struggling overall, and the Conservative Party made a calculated decision to allow the public sector to rely more on private care. This was not an accident. It's part of their ideological push, but not every part of the NHS can be sold off. The unprofitable parts will remain in public hands. while profitable sections have been quietly privatised. The Tory government has failed to address the real problems here, and now Wes Streeting has a monumental task ahead of him if he genuinely wants to fix the NHS. Let me know what you think in the comments. As always, I'm Jake from Just Jake, and remember, make love, not war, because there's no room at the NHS, mate. No one will be able to treat you. You actually made it to the end of the video. If you would like to subscribe to the channel, which, why haven't you already, is somewhere over there. And also, if you want to watch more videos, also check out over there. I've been Jake from Just Jake. See you later.